Good afternoon. My name is Mindy Kendall, and today we'll be talking about Johnson & Johnson's charitable contributions. I also know something about charity as I donate my time to Habitat for Humanity to assist those less fortunate. Our agenda today will be commitment to the Millennium Development Goals and financial commitments, medical contributions and education, continuing their tradition of caring. The UN's Health 4+ provides training of skilled birth attendants to ensure better outcomes for mothers and babies. Johnson & Johnson partners with the H4+, a first-of-its-kind partnership to train skilled birth attendants in emergency obstetric and newborn care and to develop the healthcare workforce in Ethiopia and Tanzania. The partners include UNAIDS, the UN Population Fund, UNICEF, the World Bank, UN Women, and the World Health Organization. Helping Babies Breathe trains healthcare workers in low-resource settings to intervene when newborns have birth asphyxia, a potentially fatal inability to take the first breath of life. With Save the Children, the American Academy of Pediatrics, and the United States Agency of International Development, our Helping Babies Breathe partnership aims to prevent these conditions in Malawi and Uganda. This is an extension of a decade of work to address birth asphyxia, including a partnership in China that saved more than 90,000 babies in the first 5 years and cut birth asphyxia deaths in half in 360 hospitals. We are now supporting programs to address birth asphyxia in 12 countries. Survive and Thrive is a new global development alliance created in 2012. Brings U.S. obstetric, pediatric, and midwifery professional associations together with the United States Agency for International Development, private sector, and civil society organizations in a first-of-its-kind program to improve the quality of facility-based maternal, newborn, and child health services. Johnson & Johnson is supporting the initial work of this program in Burma and supported the new U.S. government partnership with that country to lay the groundwork for a peaceful and prosperous future. Cash contributions include the company contributed over $131 million in cash to organizations in the United States and around the world for corporate and operating companies, programs, and projects like those highlighted above. Non-cash contributions. Johnson & Johnson's companies also made $835 million in non-cash contributions. Of these contributions, the company donated $612 million of selected prescription products to patients without adequate financial resources in the United States through the Johnson & Johnson's Patient Assistance Program. Contributions also have increased from 2011 to 2012, increased by 36%, and have reached $706 million. Program leads to healthier communities. Afram Gyaning is Chief Executive Officer of Care Alliance, a healthcare center that services the disadvantaged. He also is among nearly 680 U.S. executives who have graduated from the UCLA Johnson & Johnson Healthcare Executive Program. This leadership and management development initiative sharpens leaders' skills so that they can help their community-based organizations improve and expand care for the people that they serve. Global plan to fight AIDS. The global commitment to halt the AIDS epidemic is one of our most pressing priorities. We work with many valued partners and support more than 120 HIV/AIDS programs spanning nearly 50 countries. Together we work to prevent the spread of HIV and reduce the burden of AIDS on women and their families. Keeping kids healthy at school. Johnson & Johnson established the School Health Leadership Program to strengthen the healthcare workforce and improve practices that impact student health. The curriculum includes sessions on project management, leadership program planning and evaluation, community empowerment, culture competency, and online continuing education courses. Beating the odds through education. This includes through an educational aid program, Foundation Transgender focuses on bringing the underprivileged and high-risk children into the Colombian education system from preschool to high school. These children and their families are also supported by social workers who provide supervision and academic follow-ups as well as promote overall social and individual development. Children teaching children. One such strategy is the Little Doctors program launched in 2010. In this novel child-to-child outreach effort, students from 4th to 5th grades are selected and trained to serve as little doctors. They assist their teachers on health promotion days and help their classmates learn about the STH and how to prevent infections. They also encourage children who are not attending school to do so on deworming days. Empowerment through health literacy. Over the last 20 years, the UCLA Johnson & Johnson Head Start Management Fellows Program has trained over 1,400 Head Start directors to be better managers and has expanded a successful literacy health education approach to tackle other health issues facing the Head Start community. Committed to recovery in Japan. The Tohoku earthquake and tsunami struck northern Japan on Friday, March the 11th in 2011. In the days that followed, the Johnson & Johnson family of companies made a significant financial commitment as well as product donations, while employees and retirees gave generously to disaster relief partners including the Japanese Red Cross Society, Direct Relief International, International Rescue Committee, Project Hope, Save the Children, and World Vision. Rebuilding New Jersey Strong. In late October 2012, Hurricane Sandy forecasted path put communities along the entire eastern coast of the United States on alert. Working with our disaster relief partners, nearly 20,000 disaster relief kits were pre-positioned for distribution in the hardest hit areas of New Jersey, New York, and Pennsylvania. Meeting community needs. Nearly 40 years ago, senior leaders at Johnson & Johnson were exploring the possibility of moving the worldwide headquarters from New Brunswick, where the company was founded in 1886. Rather than leave the city to face a challenging economy and urban decay, the company made a commitment to stay, with the understanding and commitment that urban revitalization was multifaceted and required a collaborative approach. A public-private partnership was established to manage the revitalization process, and a community poll was created to help inform decision-making. Building new social bonds. A lottery system and demographics guided placement of many of those displaced by the disaster into temporary housing units, at times breaking apart centuries of social bonds and resulting in increased isolation for residents. The Nippon Foundation and Wat Fuko Collaboration Center, with support from Johnson & Johnson, created a program to improve coordination among local leaders in 200 temporary housing communities in Iwate Prefecture. Along with volunteers and area managers, assessed the health situation, living conditions, and social activities of each neighborhood. This helped to inform ways to improve the support necessary for people to begin rebuilding their lives. Providing comprehensive postnatal care. A grant by Johnson & Johnson and the Nippon Foundation have now support Tokyo Midwives Association establishment and operation of 11 Mama salons, maternal care salons. Midwives supervise postnatal stays of up to 1 month, provide child care lectures and consultations, and administer weight and growth checks to the infants. Are there any questions? In conclusion, we discussed the commitment to the Millennium Development Goals and financial commitments, medical contributions and educations, as well as continuing their tradition of caring. It's proven that Johnson & Johnson does a remarkable job giving to charity. Thank you.